Welcome everyone to this week's session of the WHO Costing, Budgeting, Financing, and Delivery of COVID-19 Vaccines Learning Series. Today's session is focusing on regional approaches to support COVID-19 vaccination costing and budgeting in countries in the Americas and Europe. My name is Bruce Drumminger, and I'm going to be the first to welcome you and running through a few logistic items. Next slide, please. First, we have interpretation available today in French, Russian, and Spanish. That's available by clicking on the interpretation icon or little globe at the bottom right of the Zoom toolbar. Click on interpretation and choose the language you would like to hear. If you want to mute the original audio so that you only hear the interpretation, there's an option for that. Next. We really look forward to your questions and comments about today's topic. Please put those in the Q&A feature at the bottom right, but just to the left of the interpretation icon. We'll be monitoring that and hope to get to as many of your questions and respond to your comments as we're able to. If you have an IT or logistic question or a question about the certificate of attendance, please put that in the chat and we'll try to help you out as best we can. Next slide. We do have a live transcription, closed caption of the English. So if you want to use that, there's a live transcript CC in between the Q&A and the interpretation. And if you click on that feature, you'll be able to read the closed caption of the English. Next slide. We are recording today's session as we've been recording all the sessions in this series, and your attendance is consent to be recorded. Thank you for that. The recordings will be shared after the session, the English recordings, the French, Spanish, and Russian recordings, and we'll share links in the chat for to the websites where you can access these recordings as well as the PowerPoint presentations, etc. We will be offering a certificate of attendance. It's through the University of New Mexico, where Project ECHO, partner in this initiative, is based. We'll share a link to that, to a survey at about 15 minutes before the end of the session. We really appreciate the feedback you will offer us on how we can improve these sessions, how you thought they went, what you liked, what you think can be improved for future sessions. Next slide. Just a note about the data and how your data that you share with us when you register and when you respond to polling questions and in the Q&A, all that data is very carefully stewarded and it's all de-identified. And when we share it with WHO, it's de-identified. Next slide. With that, it's my pleasure to pass the microphone to Karine Jung at WHO to formally welcome us and moderate the session. Karine.
Thank you, Bruce. Good morning and good afternoon, everyone. I'm Karine Jung from WHO headquarters in the session department. Next slide, please. Today is the 7th session of this excl series. We are glad to have the representatives from the European region and PAHO to talk on the regional approach to support COVID-19 vaccination costing and budgeting in countries in the regions of the Americas and Europe. Next week at noon, Central European Summer Time, we will have a session on Pfizer COVID-19 vaccination planning and implementation. And here listing all the following sessions, and registration is already open for all these sessions. You will find the registration link in the chat. Next slide, please. And for today, we will first have Dr. David Sulebres to talk on the planning and costing of COVID-19 vaccination in European countries. Then Dr. Grampo Plum Pagano will present the NDVP costing in the Americas, including technical support and results from NDVP analysis. And after each presentation, we will have 5 minutes for Q&A to clarify the contents of the presentation. You can put your questions in the Q&A features at the bottom of the Zoom toolbar, and we can discuss together. Next. And this session aims to exchange the experience of support on COVID-19 vaccination planning, costing, and budgeting in the countries in the regions of the Americas and Europe. We anticipate that after this session, you will be able to know how the COVID-19 vaccination planning and costing have been organized at the regional level, and understand how countries being supported to use the CIVIC tool, and learn the results from NDVP analysis in the Americas. And before going into the presentation, I would like to have some warm up with the pool. Can the ECHO team please open up the pool? And let's have some interaction here. You can see there are 4 questions that we would like to understand from you all, and you can scroll down to see all the 4 questions. And the first question is, in which WHO region do you work for? Afro, Emro, Euro, PAHO, Ripple, Sierra. And second, what was your involvement in the development of the NDVP for COVID-19 in the country? In charge of or collaborator in the costing and funding session, in charge of or collaborator in other sessions of the plan, external advisor in the costing and funding session, and external advisor in other sessions of the plan, do not participate in the elaboration of the plan, but knows it, did not participate in the elaboration of the plan and does not know that. And third question, in your opinion, what is the main challenge that the country faced or is facing to accurately plan for the resource needed and its cost to implement their NDVP for COVID-19? And you can choose uncertainty with respect to vaccine doses arrival, insufficient local technical capacities in costing and or vaccine financing in general, insufficient time to perform the task caused by deadlines imposed by international organizations, lack of technical tools or clear guidelines for the task, or others. You can specify your main challenge in the chat. And lastly, have you used the COVID-19 vaccine introduction and deployment costing tool, CIVIC? And yes, completed. Yes, but still working on it. Yes, but could not complete. Heard of it, but never tried. And lastly, never heard of this tool. And as long as the ECHO team is ready, we can show the results of the pool. Okay. Okay, good. So most of the participants are from Afro and then PAHO Euro. And then for the second questions about your involvement, okay, most of you did not participate in the elaboration of the plan. And hope that in this session, you will know more about that. And for the third questions, the main challenges is the uncertainty with respect to the vaccine doses arrival. Yeah. And then, okay, half of you did not heard of the CIVIC tool, and only 40% tried and complete. Okay, good to know that. So, and we can now start today's presentation, and maybe next slide. And let's start the first presentation by David, a consultant of UNICEF Europe and Central Asia Regional Office. And David, please.
Thank you very much, Karen. Hello, everybody. My name is David Sulaberidze, and I was supporting some of the European countries in capacity of the UNICEF consultant in the process of development of NDVP plans. Next slide, please. In the Euro region, development of the NDVP plans started from the beginning of 2021. With this presentation, I'd like to share my personal experience in working on this subject and about the countries I've been working with. Georgia completed the plan by the end of January 2021. Central Asian countries, Uzbekistan, Kyrgyzstan, Tajikistan, by the end of February 2021, and Kosovo completed its plan in February 2021. Next slide, please. The methodology and guidance used for the NDVP development, it was quite a new subject for all these countries. So, we used two different types of methodologies for development of a programmatic part of the plan and the costing and financing part of the plan. And that was the first wave of NDVP development. So the programmatic part was based on the guidance published by WHO and UNICEF in November 16. And that was interim guidance on developing a national deployment and vaccination plan for COVID-19 vaccines. The costing and financing plan, since the civic tool was not available at that time, we found the most relevant methodology, guidelines for estimating costs of introducing new vaccines into the national immunization system, published by WHO Geneva in 2002. With the reason for choosing this methodology was that the COVID-19 vaccine introduction, by its essence, was the introduction of the new vaccines, even though it was not included into the national immunization schedules. Again, the components of the costing and financing were quite matching. Next slide, please. After some time, 3 countries out of these 5 decided to revise their NDVP plans and to update it. And this revision was requested by the governments of those countries. Unfortunately, Georgia and Kosovo did not decide and didn't make the strategic decision for revision of the NDVP. Next slide, please. Purpose for the revision was to update both parts of the plan, programmatic and financial parts of the existing documents, in order to incorporate the new realities in the plan. And these new realities were related to the 3 components of the plan. The first, all these 3 countries revised their strategies for selecting of target vaccination, target population groups, and the sections related to the targets were revised. The next topic for revision, or next area of revision, was related to the vaccines received and expected in the countries, because in difference with the first edition of the plan, where we had quite uncertain situation about the vaccines that were expected or potentially were expected by the countries. At this time, during the revision, we had much more information of what was already received, what was allocated, and what was expected. And the third major area for revision was the cold chain part of the NDVP plans, because because all these 3 countries decided and managed to secure Pfizer vaccine, and as we all know, Pfizer vaccine requires a specific ultra cold chain conditions of the cold chain system. So, and of course, these changes in the programmatic part and in the strategies of the plan required significant and comprehensive revision of the costing and financing part of the plan, and revision of the revision of the costing part with regards of defining existing resource gaps for implementation of various components of the NDVP plans. The next, please. During the revision process, we used the revised interim guidance for NDVP development, which was published on June 1st by the WHO and UNICEF. And at this time, for costing and financing analysis and component development, we used the civic costing tool that became available to us. Next, please. The advantages that we found during the civic application were following. First of all, preloaded country-level critical data on demography, epidemiology, geography, logistics, human resources, and health financing was very helpful because it allow us to save a significant amount of time during this exercise. Because normally, while working on such comprehensive plans, it depends on the country, but data collection is one of the most complicated part of the work because of many reasons. In some countries, information is not available. In other countries, the government is not sharing this information easily, and etc., etc. So that was definitely very helpful to have this data preloaded. And in that context, it just required us to revise existing information and to fine-tune it if the better quality information was available in the countries. The next point that was very helpful in the work, it was ability of the tool ability of the tool or flexibility of the tool that allowed all key stakeholders to work on the respective sections of the tool independently. And with this feature, it required the minimal involvement of technical experts and external technical assistance to finalize the sections that were respective for the implementing partners or the government. Another point was flexibility in considering different delivery strategies. I mean, the construction of the civic tool allows to accommodate any kind of any potential vaccination developing strategies, which was very helpful. And finally, capacity to accommodate different scenarios of COVID-19 vaccine introduction that allowed us to translate the reality into the figures and budgets easily. Next slide, please. Disadvantages of civic tool application, I would call it not disadvantages of the tool, but kind of problems that we faced in a particular context while working on costing and financing through the application of civil tool. First of all, at the time we've been working on this exercise, we didn't have a guide or user manual for application of the civic tool. That required lots of efforts of all participants of the process to figure out how the tool, different sections of the tool had to be populated. And thanks to our colleagues, they provided us support with that and revised our work. The next point that I would like to note is the complex design of the tool. That requires quite an advanced knowledge of excl program, or at least it requires some time to work on the tool and to study the tool, which in the context of those countries when everybody was busy with the management of COVID pandemic and the vaccination process was quite a complicated issue. That's why, I mean, it's a for currently and in this context, there is a heavy reliance on external technical support due to the insufficient technical capacity in some of the countries for application of the tool, or lack of time of existing professionals to study and to allocate some time and study the tool. Low knowledge of in-country stakeholders in benefits of civic tool application would be listed as one of the disadvantages, because the tool really needs to be promoted among the key stakeholders in the countries, because all the governments or responsible authorities tend to apply their practices, their regular practices for conducting costing and financing analysis. And finally, due to all these factors, there is a low motivation of in-country stakeholders to use civic tool for costing and financing exercise. Because again, it's linked with the previous point. They don't see the benefits. They do not fully understand how easy could this process be accomplished through the application of civic tool. Thank you very much. With that, I think I will complete my presentation. Thanks. Over.
Thanks a lot, David. And I see questions in the Q&A. So if any participants have other questions, can also put in the Q&A features at the bottom. And the first question is how civic tool is addressing the short shelf life of vaccine, the supply uncertainties, the type and schedule of the vaccine. So maybe I can first have a try on that, and then maybe David can also supplement. And so I think for the civic tool is using there is a vaccine database that is updatable. And so all the vaccines that is under the EUL already incorporate in the civic tool. So all the vaccine types and also the number of doses required already incorporate. And so just you need to choose the vaccines, and then all the recommendations already incorporate. And also and then for the supply uncertainties, I think this is the main problem of at the start of using the civic tool, and also for the costing and planning process. And so this is something that when you first start using the civic tool, then you may have an initial plan, and then maybe sometimes you may also have the adjustment, like what David mentioned. Some countries already have the NDVP done, and then some months later they also need to update. And the good of the civic tool is that you don't have to repopulate the data again. When you have more information, then you can reuse the information in the tool and just update like the populations or other changed factors. Yeah, I think maybe David, do you have any supplementation?
Yeah, I would add a little bit about the uncertainty. Of course, it's uncertain. I mean, there are a few countries that have complete information about what to expect with regard to vaccine arrival in the countries. But the civic tool is just is an instrument to translate reality into the plans. So, and reality is so dynamic that, of course, civic tool would require regular update. At least, I don't know, in those countries, it was already like during 1 year, we kind of revised it at least once. Okay, so
yeah, fully agree with David. Yeah, because of all the situations is changing so fast. So I think the tool is an instrument to help to reflect what's going on and what's the plan. And so we can also change the civic tool and then to accommodate. And we also have another questions and about the civic tool and Tiny that one problem also help reply. And since we don't have more questions, maybe I can just raise this up. So the colleague mentioned, asked whether the civic tool used to cost for the initial plan only, or whether it can be used for later or after the vaccine plan. And yes, one problem already raises, this civic tool can be used for not only the initial plan, but you can also use it to update. So when you have any other updates of the plan, you can use the civic tool and just change the elements that you have updated, and then you can cost for that. And like if you have changed the decision on the vaccine type, vaccine products, or other things, then you can just change the tool, and then you can have the estimation quickly. Any other questions? You can also put in the Q&A. Okay. Yeah, and so when we are waiting more questions, I have a question to you, David. And you mentioned that there's the low motivation of in-country stakeholders to use civic tool. And how did you get the countries convinced to use the civic tool? And since you are experienced in civic and knowing the country so well, what do you think the needs of the country regarding costing tool or in the costing process?
I mean, the countries had the main motivation for the countries to revise NDVP and to use civic tool was to complete application to the COVAX platform and bilateral partners or bilateral agreements, because I mean, civic tool was kind of trademark or kind of assuring the quality of the work done. Okay, so that I think was the main motivation. So in the countries that we've been working with, I think that the credit of the tool has already been raised because they saw the results and they saw how less time consuming is application of this tool, or to do costing and financing analysis through this instrument than to go with their kind of current or traditional practices when it would have required many months of work of different institutions and authorities to put together such a comprehensive plan. Thank you. Over.
Yeah, thank you. Yeah, and I see some requests on the short demo on the civic tool. Yeah, so we already have an online free course in Open WHO. I think the colleague can help put the link in the chat. So there's a Open WHO course that you can attend. That's around 8 lessons, and just you can take your own pace to take the course. Then this is a whole demonstration of the use of the civic tool. There's also questions of when was the tool designed and was it designed by WHO only. So for the development of the tool, I think it's already started, like the first launch of the tool is November last year. And then this is the first version. And then now we go to already the 2.2 question, 2.2 version. And then this is in collaboration with UNICEF. And also during the development, we consult other partners like World Bank, Gates Foundations, and also other colleagues to involve in the COVID-19 vaccination support and funding to make sure that the tool will be useful for all countries and donors. And since another question here is this tool used need in countries that have UHC, universal health coverage? And so for not sure, David would like to respond on this.
I'm sorry, I didn't quite I couldn't understand the question. Can you please
Yeah.
repeat it?
Yeah, so I guess that this is asking whether this is the tool is needed for countries that already have a very good coverage of the COVID-19 vaccination. This is my guess, or if Joe's have can also clarify.
All right, so if the countries already defeated the pandemic, they don't need civic tool. This is civic tool was designed for planning of the COVID-19 vaccine introduction in the country and vaccination in the country. So, but at the same time, if the countries have today this COVID-19, I mean, the good coverage figures, so I think that pandemic, unfortunately, will not be ended this year. So, and they will need another plan for another year. So that's why I see potential for those countries as well. If, of course, they like tool and they find it useful.
Okay, thank you, David. And another questions, I may not understand correctly. So can civic tool helps in compensation of the fund used from other heads for COVID-19 vaccine and vaccination initially? I may not understand this well. Not sure whether David or other colleagues understand that. Or how many you can also please clarify your questions. Yeah, I think we can come back to these questions later, but please help clarify, help us understand your question, and then we can answer you in the next Q&A session. And it's about time we should move forward to another presentation. And thanks very much, David, for the presentation.
Thank you.
And next slide, please. Okay, and my pleasure to hand over the microphone to Dr. Juan Pagano, the technical officers of the Health Systems and Services Department at PAHO, to present the technical support and results from NDVP analysis. Juan Pablo, please.
Thanks, Karim. Not actually a doctor, but that's fine. I'm coordinating the technical cooperation on budgeting and costing of COVID-19 vaccines in the whole region of the Americas. So in that, from PAHO, WHO regional office. So in that capacity, I'm intended to present a little, a broader experience around how countries did on the costing and budgeting of their national development and vaccination plans, and what's our technical support available, and how we actually supported countries during this process beyond the civic tool. So next one, please. So this is the outline of the presentation, next one, please. So from the point of view of the national deployment and vaccination plan submissions, we had in early 2021, 23 countries in the region of the Americas that had submitted an official NDVP to the partners platform. So this included 10 A and C countries. These are the ones that receive COVAX doses as donations, and 13 self-financing countries, that's SFC. So 23 in total. This process, remember, that was mandatory for the AMC countries to obtain this sort of green light to receive the COVAX supply vaccine doses, but was voluntary for the self-financing participants. This process was complementary to other activities, including the VIRAF checklist that countries had filled before in terms of their readiness to start vaccinating and receiving vaccine doses. And the most notable, I would say, feature of this process was that out of all of the sections of the plan, costing and funding was expected to be one of the weakest because the technical capacity and expertise in budget and costing for vaccines in general, and in particular in this case for these new vaccines, was low in most countries, not only in our region but globally. And this expectation was fulfilled when we reviewed the plans. So these plans were intended to be produced in collaboration with WHO and UNICEF offices, but sometimes, as you will see in the process, we kicked in for second drafts. After the first submission, we provided comments, and then with this back and forth, we helped improve these plans. Next one, please. So in general, not specifically in costing and funding, the revision process in our region and in all regions started with the formation of a multidisciplinary regional review committee, RRC, that was formed to review these plans, several parts of these plans, not only the costing and funding. So we have mainly people from the immunizations department, but also colleagues from health systems and services like myself, providing feedback to these plans using what WHO produced, this standard review form that had several questions regarding specific components of the plans that the technical advisors had to assess whether these questions, whether these components were present in full, partially, or no, and provide comments. So that's the way we, as a regional review committee, assess these plans. So we have subgroups within the whole regional review committee, and then we came back all together to have like an overall view of the whole plans for each country, not each component separately, but after each of the technical units revised each component separately, we came back all together, and for the AMC countries provide the approval with or without revisions for going ahead with the allocation of doses. Next one, please. So in particular, for the costing and financing component of the revision of the plans, the 4 questions that were part of the standard review form are the ones that you see there. It might be a little small, but I can read them out loud. So the first one is the plan accompanied by cost estimates and a reasonable budget for plan activities? The second question was, are funding sources clearly described, including secure funding sources? And the third one was, are budget gaps identified? And lastly, does the plan describe a strategy to address the budget gaps identified? So we as the reviewers had to answer yes, partially no, or do not know or cannot assess. And then there was a column in which we could provide comments, and this was sent, countries could see this, and before the final submission, we have this back and forth with countries. Next one, please. So one of the technical challenges that we faced as reviewers was that as reviewers, we needed to come up with certain criteria to define, for example, what was a reasonable budget, among other elements, because the question that we had to answer was whether the NDVP provided a reasonable budget. What is a reasonable budget? It's not too easy to assess. So we had to rely on several mechanisms for the task. The first thing, obviously, was a detailed review of what was stipulated in the NDVP guidelines produced by WHO and UNICEF. The first version of it and the revised version, that for each of the chapters of the NDVPs, it provided specific recommendations and a stepwise approach on how to fill in and produce in each of the sections. So we had to review that and see whether the plans actually follow those guidelines. The second thing that was very important for us was discussion with other regional colleagues and headquarters in WHO, especially with Natalie that is connected here and other colleagues, to see what are the challenges they were facing in other regional review committees when reviewing the plans, because I mean, this was something new that wasn't, we didn't have a specific guideline for this specific section on how to review, and discussion with colleagues was very important. Another source of I would say of advice was reviewing the international evidence available, specifically this estimation that the COVAX group produced on global unit cost estimates for delivery of the vaccines. There are a couple of versions of this work, and they are also now updating these estimations. But this work provided global estimations on unit costs and for each of the components of for delivering these COVID-19 vaccines. That was a source of reference for us when reviewing specific individual country plans, and also other estimations like data from the immunization economics database that has already by country unit cost of delivering routine vaccines, which are very different from these vaccination plans for COVID-19, but also provide some reference for us. And then we have to go case by case, reviewing each of the plans and the costing part of the plan, and to check whether or no components on the plan were missing in the costing section. So that then we have this back and forth with the countries for questions, clarifications, and have them improve their plans for final submission. So all of the feedback on costing and finance also was discussed among the larger group within the revision and review committee. It's not that we, the finance people, provide a comment around costing, financing, and budgeting, and others provided members of the regional review committee provided other comments, but we try to come back all together. Next one, please. So in general terms, all submissions were finally approved with some with minor revisions. This is for the 10 ANC countries in our region. We confirmed that actually the costing and funding section of the plans was one of the weakest by far in this assessment. We guess that maybe because of that, the costing and budgeting and funding component of the plan was taken out of the critical elements to be assessed for the go no go decision or for the approval, because in reality we saw that countries struggle a lot with producing good estimates of the expected costs, and maybe because we as a global health community didn't want to block vaccine doses arriving at countries. I think that these elements were taken out of the critical elements to be assessed for the go or no go decision. Despite being informed by the same guidelines, the quality, the amounts, and several issues of the plans were very heterogeneous between countries. They were very different, and as we will see, unit costs varied great between countries, great. So we offer our technical cooperation with CIVIC, trying to get ideally a local consultant on board to help countries use the CIVIC tool. But at the time of the revision for the regional review committee, most countries tried to concentrate on improving the sections of the plans that were assessed as critical elements for the decision on allocation. So at that time, most countries didn't concentrate too much on the costing and funding because of this issue. Next one, please. So for the self-financing countries, these 13 countries that we assessed, we didn't fill specifically each of the standard review forms, but had an overview, a general overview of them using a traffic light sort of system for each of the components to see whether the component was totally absent, that's in red, or partially included or developed, but not so much on the quality or the reasonability of their estimates. And as you can see, for the 13 self-financing countries that we assess, you see a lot of reds there in the costing section. So for many countries, it was absolutely absent in the plan, or the development was really poor. You see very few greens there. This is for the self-financing countries. Next one, please. So I just wanted to kind of wrap up to show some results from the detailed NDVP analysis for all the countries, ANC and self-financing participants, to see what they came up with in terms of their estimation of their expected cost. So in the next one, you see that for the next one, please. You see the total budget including vaccines varied greatly. This is obviously mainly because we can't see the name of the countries because it's still the specific country information is still somewhat confidential for us. So you will see numbers, but each column represents a country. So the total cost of what was budgeted for the plans varied greatly, but the total amount doesn't give you much information because the sizes of countries are very heterogeneous as well. But in the next one, you see that next slide, please. You see that, for example, there was a great variation in terms of what the total expected cost of what was planned in the NDVP represented in terms of as a proportion of past health expenditure. Well, the latest data that we have is from 2018, and you see in the blue bars for each of the countries what the total budget for the NDVP represented in terms of percentage of current health expenditure from 2018, and the red cross represents as a percentage of only public health expenditure, bearing in mind that for most countries the vast majority of the resources to fund the plans will come from public sources of revenue, including external sources that are channeled through government. So you see there lots of differences, and countries that have in which, for example, the total budget represented around 8 or 10% of total health expenditure, and even 10 to 15% of public health expenditure. There's a country there that it's an outlier, the one that you see with an arrow, because for that country, as a percentage of public health expenditure, the budgeted plan represented upwards of 30% of public health expenditure. So I had to break the scale there for the graph to be more nice. So it was important. It's as you can see, having to budget for something that is new, that didn't exist in the past, that represents 10% of your total health expenditure, or 10 or 15% of your public health expenditure. It's very important. Next one, please. And in terms of the delivery only unit costs, in this case, we excluded vaccine doses, human resources, and ultra cold chain to make these numbers comparable to what the COVAX group came up with in terms of the unit cost of the delivery. So this COVAX group estimated around $1.45 per dose unit cost only of delivery. So if we take out the vaccines and the human resources and ultra cold chain from the numbers that we have from these countries in the Americas, and divide that by the number of doses stipulated in the plans, we see that the unit cost varied greatly as well. We have countries with, according to the information they provided, with estimated unit cost beyond $5 per dose, and which is much higher than some countries that have less than $1. So it's we know that, for example, in the Americas, we have countries that are very small because we have the Caribbean islands, and their unit costs are much higher. But most of the difference that you see here are not because of that. It's not necessarily because of size or characteristics of countries per se, but we can't explain. So it kind of gives a hint that what countries did was very different, and probably the quality of some of the plans was subpar. Next one, please. And I wanted to end with some other challenges that have to do with financing for COVID-19 vaccines. So some of the challenges we faced with reviewing the plans was that, for example, the expected population coverage in the plans varied greatly. So some countries only budgeted for the 20%. That was the original goal for 2021, and some countries even budgeted for a coverage of the 100% of the population. So the average was around 50%. So it's difficult to assess the quality of plans and to when with the actual expected population coverage varies that greatly. Several countries, this is very important, did not budget for new human resources for health recruitment, or even for extended hours for vaccinators and the expected HR surge that countries would face. So this was part of our technical cooperation in the back and forth with countries, saying, okay, you are not including in your costing and in your projected budget any new recruitments or extended hours, and you will most countries will need extra workforce for the vaccination campaigns, and you need to it's important to cost that. Sometimes other drivers of the cost are also absent. Typically delivery by outreach. This is very expensive because you have the transportation, the per diems, etc., and it's a huge driver of cost. And in many or some of the plans, the countries didn't budget for that. There's the important issue that most of the budgets went until the end of 2021, but we will need with our technical cooperation and support to countries to bear in mind that these recurring costs will need to be included in the future budget preparations, because as David mentioned, we don't expect the pandemic to be over very soon. So this will become at some point somehow part of the routine immunization programs, and so it's not a one-off effort to plan for 2021 plan and then see each year, but we need to include that on the budget preparations. And it's important that the funds flow at some point start flowing through the regular existing financing mechanisms, instead of creating a new vertical plan aside from the national routine immunization programs and the health system in general. Because in the I would say the emergency phase of the pandemic, it was fine to have this separate extra budgetary unit, but for the future we need to be including the regular mechanisms. Next one, please. And with this one, I think I finished. So other areas to strengthen, I think it's important that we coordinate and plan jointly several health system components with countries, because they are all essential to the vaccination efforts, but also as part of the overall health system response to COVID-19. Not to see vaccinations as a separate component and as a separate financing, I would say, challenge, but within the whole health sector response to COVID-19 in countries. This is especially important in the context of, as usual, scarce domestic resources, with the expected reduced fiscal space for health that we will see, because all the challenges that countries are facing with lower revenues from the pandemic. And so we need to have this overall comprehensive approach as a health system to the response to COVID beyond vaccination, but including vaccination. So we think it's important by focusing on vaccinations, not undermine other essential health services provision, and even the routine immunizations as well. So we need to think as an overall comprehensive health system in terms of the response to COVID and including vaccination. So for this, it's important to continue making our technical cooperation proactively available from partners, especially WHO, including the civic tool, but beyond the civic tool, but very tailored to country needs. It's important to strengthen the coordination with multilateral development banks at the country and regional level, because these are important funders of these plans at the country level. So we need to be very in close contact with them to coordinate activities in countries. And also there are other elements or tools for an integral and comprehensive approach in terms of coordinating several initiatives, like bilateral thematic missions. We have this interaction review or mini COVID-19 post-introduction evaluations that when we virtually go to countries to assess what's the status of the implementation of the vaccination plans, including the financing perspective, but within a comprehensive approach. So again, collaborating with other areas of our health systems colleagues and the immunizations colleagues and other and other short virtual missions and on cooperation in general. So I leave it there, and thank you very much for your time, and I keep I will answer any question that comes up. Thanks.
Thank you, Juan Pablo. Yeah, so if anyone have questions, so please put in the Q&A features at the bottom of the Zoom toolbar. And we have 5 minutes left for this session. It would be good to have a question from you. And when we are waiting for questions, so maybe I have a question to you, Juan Pablo. As you mentioned, some cost drivers may be absent in the budget. And for example, like human resources and some outreach delivery. And most of the plan were until 2021. And did you aware any countries in the Americas are going to cost for 2022 or onwards, or to include the this cost driver, and what's your advice on this?
Yes, so some of the plans went beyond 2021, no, for 2022 at most, not 2023. But one of yes, exactly, one of our support directly with countries was to remind them of the need of including these other elements that are important cost drivers. The thing is that most countries, by the end of the start of 2021, were rushing to finishing this costing and the plans for the mostly for the COVAX requirement. So at some point, I think they might have thought that for the moment, for the arrival of vaccines to cover 3 or 5% of the population, they could go without contracting new or having new people on board to help with that. But yes, in the new revisions and the new versions, they are all thinking of this, and we are supporting. We try to support countries in the way forward and in the budget preparations for years to come. Yes.
Thank you. Yeah. So till now we don't have more questions. So please continue putting your questions in the Q&A. But now I would like to just move forward for the closing and with the feedback pool. And thanks very much, Juan Pablo, for your presentation. And so coming to the end of the session, I would like to end up with the feedback pool to understand how much you learned from this session. And can ECHO team please put up the pool? And we will have 3 questions. And so you may see now in the pop-up box. Yeah. So first questions, has the session improved your knowledge of COVID-19 vaccine planning, costing, and budgeting in Europe? And the second question is has the session improved your knowledge of COVID-19 vaccine planning, costing, and budgeting in the Americas? And you can choose yes or no. And the third question is the experience applicable to your area of support to COVID-19 vaccination? And also yes or no. And please provide your questions here, provide your answer here. And when we have enough response, the ECHO team can also show the result of the poll. Okay, great. So I think more than 85% of you understand more about the costing process and the planning process in the 2 regions, and find this experience match your area. That's very good to know. Thank you, and thanks very much for your participation in this pool. And next slide, please. And this slide will show you the webinar materials, including the recordings and slides. And if you have further questions after the session, you can also ask in the TechNet 21 forum or Telegram. And thanks very much the TechNet team for supporting. Next. And you can find the recordings of this session in English, French, Russian, and Spanish. And next week at noon Central European Summer Time, we will have a session on Pfizer COVID-19 vaccination planning and implementation. The session will be in English, French, and Spanish. And you can see the registration link. And next. Yeah, okay, that's the last slide. And thanks very much again for your participation. And we look forward to seeing you again in the future sessions. And thanks to the translator during the excellent interpretation, the ECHO team, presenters, and all colleagues supporting the session. And any questions that are related to the session topic that has not been answered will be shared with the technical experts. And answer will be provided through email. Thanks a lot and bye-bye.